Hello everyone, it's Ms. Sherina Balaratnam here, Surgeon and Medical Director at the S-Thetics Clinic in Beaconsfield. I am here at the amazing Royal College of Physicians, and we are at the Wigmore Presents Conference Weekend. It is the end of the agenda. I am here with the one and only Dr. Robert King, all the way from the US, and you have been discussing all things exosomes, functional as well as regenerative and longevity medicine all weekend. Science has been amazing, the research, the clinical data. We're also celebrating 2 years since you officially launched this here in the UK, as well as 2 years at our practice. Congratulations. How do you feel?
Thank you. Honestly, it's an honor to be invited back and to be here, with fellow colleagues here in the UK and surrounding areas. And it's been an amazing journey with XOE. Obviously, you've had it in your practice for a couple of years as being the first provider to bring it on here in the UK as well. So congratulations to you too.
Thank you so much.
It's been fun to see the evolution of really, it being utilized really around the globe, but especially here, and having practitioners come up to me, from 2 years ago and sharing their stories of how they're utilizing, XOE and, the success stories and the changes in their patient's skin, everything from inflammatory skin conditions,
100%.
Acne patients even utilizing the home care to see resolution, to utilizing it with the energy-based systems as well. And now we've moved on to hair, which is really exciting because we've seen this huge, almost pandemic problem of hair loss. Obviously the COVID pandemic was 5 years ago, which, wow, seems like a long time.
So fast.
But,
Time's flown.
5 years later, we're still seeing effects of that, though. We're still seeing the inflammatory conditions, major hair loss problems.
Yes.
We're seeing hair loss in females really growing, even as young as 25 years old. I think you've even had experiences in your practice in that way.
The same.
So it's a big problem. It's really the fastest growing issue we see in this kind of functional aesthetic space. And so to have a tool now with RIVE, where it's all topical, there's no needle poking, it's transdermally absorbed, there's concentrated in-office treatment, and then the take-home and then supportive care with the shampoo and the conditioner. We're seeing incredible results and really a true pandemic problem, but not just related to what we saw in an inflammatory condition like COVID, but really I almost call it the GLP-1 hair loss pandemic.
So many new pandemics since the pandemic.
Really.
As a result.
So, I mean, GLP-1s are great. People are losing weight, but as I said in the lecture, even you might lose 50% of your fat, but you can very much lose 50% of your hair very quickly as well. And so having to be able to have a solution to go along with, treating the whole patient again, right? Not just one single thing, we're helping them with weight loss, but we're going to help them with hair restoration at the same time. And then being able to, treat modalities with inflammatory hair loss conditions like the alopecia areatas, and then your traditional, traditional hair loss of, male and female pattern balding with your androgenic alopecias. So having a really strong tool, again, plant-based, very safe, topical only to utilize, I think has been game-changing. And the data, we just got the studies back and the biopsies and the 6-month longevity study.
You showed, it's beautiful.
Yeah, we just presented. It's remarkable to see that, look, things are changing. We're really on the cutting edge of this kind of functional aesthetic med space, and procedures are changing. We're not having to needle things anymore, and
I know.
we're seeing awesome response with low energy like ultrasound, and so it's fun to be a part of it. It's exciting, honestly, and then where we're going next. We have probably one of the world's leading anti-aging skincares coming out this fall that's going to have the XOE technology, and it's actually our most advanced serum we've ever developed into this. Again, it's going to be a system because we need to cover all aspects, and so we're excited to be able to bring that here soon as well. So
I winked at the camera so that our patients know what's coming soon.
For sure.
But this is beautiful, Dr. King, because we've, I say you have created together with your team something that has started, but you got the soup right.
Yes.
You got the formulation right. That base has got so much science and research backing it. And it's interesting, in my practice, everything that we've brought in has been, I would say, beyond aesthetics.
Mm-hmm.
We're not just talking about the aesthetic results. Yes, our patients do want that, but beyond that, we treated the inflammation since 2015.
Yes.
We got some great results. The lockdown came, post-pandemic, we're half a decade on, and you're now talking about core issues that our patients are seeing every single day that affects their quality of life. They may not realize the detriments of using some of these medications like GLP-1, and you've just mentioned 50% fat loss, 50% hair loss, and I'm seeing it in the 25 to 35-year-olds. So it's quality that you have brought to the clinic, to the UK,
Right.
to address such modern day issues that each and every one of us experiences. So congratulations on that and the new launch.
I appreciate that, and honestly, it's just happy to be a part of bringing a tool, as you talk about treating the whole patient. You know, you're looking at it from an inflammatory perspective and starting there, and then working your way backwards, and being able to be having like a being able to be a part of having a strong tool in that pathway, and then to be a tool in your bag of tricks, really, that we can help our patients with. Honestly, that's what we really love at Aesthetic Management Partners. That's what we love developing. It's healing from the inside out, and you know, each step of the way, we're really excited about what's to come as well. So thank you.
Likewise. Thank you so much
Absolutely.
for being with us. Congratulations on all of your launches. I've loved your presentations, and we look forward to seeing you next year.
Thank you. It was wonderful. Appreciate it. Thank you.